having worked in disasters, I worked after Katrina with a public health team in the state of Louisiana. I was not in a hospital. I didn't experience the same conditions that the people who I'm writing about did, but I have worked in other disaster zones and conflict zones, as you've said, delivering humanitarian assistance. And I have been in the situation, unfortunately, where I was standing outside of a tent in a muddy no man's land where tens of thousands of people were massing because they'd been pushed out of an area where there was conflict. And I had to decide who could get treatment right away and who had to wait, and I had to see people suffer because we didn't have everything we could give them. So I myself have been in that situation.
But now you're a journalist.
Yes.
One of the remarkable things about your story, one of the most sort of successful aspects of it from a journalistic point of view, a craft point of view, is the candor, the remarkable candor of many of the medical professionals who are involved. Dr. Poe wouldn't talk to you about her choices that particular day, but she talked about other background issues. Mm-hmm. Some of the doctors, Drs. Ewing, Dr. Tila, I guess it is, talked in great detail about very difficult choices that they made that day and how they saw these issues playing out. How did you prepare for these interviews? What went into them?
Well, first of all, I have to say I'm so grateful that they did, because a lot of the people I spoke with, they pointed out that nobody wants to touch these issues. Everybody in medicine knows that certain issues come up in terms of end-of-life care that are things that people don't like to talk about. So yes, it was a big deal for these physicians and nurses to open up about their real feelings about these issues.
And what they're talking about are their real feelings about whether or not to administer two drugs, morphine and Versed, yes, to patients who may or may not be dying, but in any event who've been given that number 3. Takes a lot of trust for even a physician who wants to talk about, or somebody who could be branded unethical or could be branded a perpetrator, to talk to you. How did that go? How did you prepare for that?
Very few people in this world do things to be evil. People generally believe in what it is they've done. And I feel like as a journalist, if you can go in there and be willing to hear that honest truth, their reality, that's the real key. And that was the same in Bosnia. You know, I wrote about a hospital where there was a genocide. There was a genocide in the town that I wrote about. And I interviewed people on both sides of that conflict. And it was that same idea of going in there and just genuinely wanting to hear their perspective. And I feel like people generally want to share that.
When you've got all these different accounts of the day, and you've got interviews with multiple people, and you've got documents, how did you go about choosing details and structure? What were some of the things you considered? What makes something a good detail versus finally a detail we can sacrifice?
Oh, I didn't want to sacrifice any of that. There are so many good details that nobody knows about after reading the story because we just couldn't put them in. And we went back and forth, and I don't know necessarily that there's a right answer to that question, because there are things that could very well have been in there. But I think one thing that really helped was a chronological structure, which is always your start in journalism. It's a great way to structure a narrative, and we did that for the most part. So that helped a great deal. And then there was the question of perspective and whose perspectives to tell this from. And this story did call for multiple perspectives, because every single person in that hospital had a very different experience of what actually happened. And in order to get some sense of a totality, or at least a larger sense of what went on there, you do have to have different people's perspectives in there. But that was hard, and I'm glad you think that it worked.
Oh, I'm sure readers will think it worked. Let's talk, since we don't have all the time in the world, about some of the broader issues. I mean, on the one hand, this is simply a fascinating inside narrative of a terrible incident. But it does have some broader implications, which you get to toward the end of your story. Talk a little bit about that. Why is this story particularly important?
Number one, people in a hospital should never have to face this kind of thing again. If at all possible, we need to do better as a country to prevent people from ever having to make these decisions and being put in this situation. So I hope that's sort of the overarching impression that people come away with. And in terms, there are, I think, two major things that have come out of this story before I got involved in it, and that are ongoing, and that I hope that we can maybe look at with different eyes after knowing more about what happened there. Two things. One is that regular physicians, nurses who heard about what happened, who heard that a doctor and two nurses who were highly respected had been arrested, very much became worried and wanted liability reform, wanted special laws that would say from state to state or even federally that you can't prosecute people, you can't sue people for doing their best in an awful circumstance.
And where do you come down on that now, after looking at this for a while?
The idea that many people are arguing for now is that we need a set of standards that are not the same usual medical standards that would apply during disasters. And the idea that doctors and nurses can't practice as they normally would in a disaster situation when resources are limited, obviously, that's a given. However, the question of whether we should change standards and how we do it, I think, is something that Americans, regular citizens, need to be brought into this conversation. For example, many people probably don't know that the ventilator protocol for a pandemic for New York City calls for certain patients to be taken off ventilators to allow patients who could benefit more from that to be put on them. Now that might sound awful. Theoretically, it might come as a shock to a lot of people. It's because the public hasn't really been involved. The public doesn't know what are the rationale. And the number one lesson about triage that I think is important for people to walk away with is you always have to be looking at what your resources are and what the status of the patient is. And a lot of these new standards aren't emphasizing the need for constantly reassessing those things.
So, as often happens with journalists, your story is hitting at a time that may give it a particular context. This story is hitting in the middle of a great national debate about the healthcare system. Is there a way in which either Katrina writ large or the events at Memorial tie in at all to this great national discussion that's going on now?
Yeah, absolutely it does. It's sort of a case study for these larger issues of how we manage resources. And it is the extreme example of having a limited set of resources that you need to figure out how to steward or split up between various people. So I think we can read this and think about what we would want on a larger level. And the other aspect is I think that we aren't perhaps talking enough about the importance of putting some investment into disaster preparedness of our health system. There is more going on in this arena, but it's not really been brought into the healthcare reform debate, and perhaps it should be. So I guess the real relevance here from a journalistic standpoint is to look at the fact that America is going to face future disasters. We're going to have more hurricanes. We have threats of pandemic diseases, including influenza this season. There are going to be times where resources are limited. There are going to be times, unfortunately, where government fails as government failed these people, and health workers and patients get trapped in very difficult situations. So the question, the whole reason to go back and look at this is to say, what can we learn? What is it that this story teaches us?
Is there anything you think I should be asking you?
That's always the best question to ask at the end of your interview.
I've heard that.
And, by the way, as a physician, too. It goes the same for the medical interview.
So, is there anything I should be asking you?
I don't think so.
All right.
I've enjoyed speaking with you.
Likewise. Thank you.